I'm Subah.
Hi, my name is Lexi Silva.
I'm Sage Benca.
Hello, this is Jared Cuevas.
Hi, I'm Emma Jurkovac. And for this project, we were required to interview a professional in the field of medicine and do some basic research. And we were grateful when Dr. Shelia Habib agreed to help us out with this research in this project. Dr. Habib is a pulmonary intensivist who works right here in San Antonio, Texas at the University Hospital. She also works as a part of UT Health and at the VA.
Dr. Habib decided to move from Texas to upstate New York after completing high school to attend Cornell University, where she earned her undergraduate degree in economics. After completing college and graduating from Cornell University in 2006, Dr. Habib then moved back to Texas to attend medical school at Texas Tech Medical, where she received her MD from.
After Dr. Habib graduated, she did 3 years of training before pursuing her specialization in pulmonary critical care at the University Hospital. The University Hospital in the VA is where she started her residency at.
Dr. Habib has many different tasks, some of which include rounds, clinical procedures, diagnosing patients, and running the lung cancer program at the VA. Her days can range from very hectic ICU days to calm and organized clinical days. Hours for this profession range from about 80 to 100 hours a week on ICU weeks and 40 to 60 hours on clinical weeks.
In the ICU, days start off early at around 8 a.m. where you and your group bounce off between patients in what Dr. Habib calls a controlled chaos environment. It ends at around 1 p.m. where your group splits off to do specialization, though that might not always be the case because some may go eat, others will focus on their procedures, make calls, or other tasks. Once everyone is done with their tasks, they go home for the night while the head of the group has the luxury of being on call.
On clinical days, Dr. Habib starts off the day by finishing anything from the night before and preparing for her afternoon clinic. Once the afternoon rolls around, she sees from about 8 to 10 patients on average until about 5 or 5:30 p.m. when she then finishes up documentation and paperwork before heading home for the night. Becoming a doctor is not an easy task, so we asked Dr. Habib what are some skills she thinks us as future doctors should have or work to acquire in order to better our career paths. One was being organization and being able to find that way of organization that best suits you so you can have a productive day. The second was just having the determination to persist through all the hardship and hard work we're going to have to go through in order to get where we want to go.
Some of the things we learned during our interview with Dr. Habib was that her undergraduate degree in economics actually helped her in advancing in her profession due to the fact that it was unlike the other applicants and pulled the interviewer's attention. She also told us how tough it is to separate your work self from your home self and not to bring baggage home from work. She told us the way to combat this was by simply having a support system, whether that be one person or a whole handful of people.
This interview helped give us a lot of insight on what to expect once we get further down our paths. This also gave us an opportunity to hear from a professional on their experience in the medical field, as well as how they got to this point. Dr. Habib has put in so many hours of hard work for the benefit of others, and we can't wait to be able to do the same thing one day.